As we all know, team sports are sort of on hold right now, depending. So right now in King County and Seattle, we don't have public health approval to move forwards with physical contact and what sports were in the past. But that doesn't mean they can't play sports and train and condition and do some things. The things that they can do are small pods, small groups of 5 or less that are physically distanced, where all the young players keep their spacing. They should never be face to face. They should use meticulous, hand hygiene before and after they get on the field. I think parents should be cautious. They should make sure that, their kids, when they go out to a team sport, when they go out to the playground, when they go out with their friends, they have to be in a mask. They have to make smart choices in terms of being physically distanced from others, careful what shared objects they're using. Before they take off their mask, they should have hand sanitizer available, and they just have to be really careful. Now is not the time to get complacent. If parents are considering whether or not to send, their kid along with the team, I think the questions that I would ask of the club is, what's your plan? Do you have this sort of safety plan in place? Have you thought about all of this from start to finish? And what does the training program look like as well? In the sports world, we screen all of our athletes before they enter an athletic facility, and we've heard about that, and I think the same thing can happen at home. So, if you're sending your child to a team sport, you should talk to them, make sure that they feel good, do your own symptom screen at home, and make sure before they get in the car to go to practice that they have no symptoms. Some parents will ask, my child had COVID-19 a month or two ago, is there anything I need to do before they go back to sports? And, with that kind of time period in between, they're not necessarily infectious anymore, but you do want to make sure that they have fully recovered. And I think the best way to do that is to check in with your physician and your medical provider, make sure that they feel well, that they're not having symptoms with exercise, chest pain, exercise intolerance, shortness of breath that seems disproportional to what they're doing. Just something new. In general, we're not recommending kids are in carpools. If you can get your kid there alone and just with your household, that is obviously the safest. But we know that's not possible in all circumstances. So there are ways to be in a car more safely. Windows down a little bit. Everyone in the car should be wearing a mask, and you should be distanced as much as possible in the seating allowed within that vehicle. So the kids, when they're there, they should be in a mask. If you're not with a housemate, you should be in a mask. And when my children go out of the house and they're with their close friends, they're in a mask. And all of their friends are in a mask, even when they're at the playground. If you don't have a mask on, I'd keep even further. And the reason I say that, the 6 feet distance is really when you're talking to someone at rest. We know this virus, if someone coughs, sneezes, sings, breathes heavily from exercise, that virus can go farther, probably 10, 12 feet. So we need to keep even further on the playing field if people don't have masks on. And really importantly, they don't cluster and socialize after practice, which is really difficult. We all want them to have that time together, but this is just not it. So they need to, get their bag and go back to their car and vehicle. And likewise, the parents shouldn't be clustering on the sideline either. We have to model what our kids should be doing as well.